So my name is Ansley Paulk. I'm doing research on the prevention of central line associated bloodstream infections in the ICU setting. So my research consisted of one big vascular access, which is called a central line, and it's going to be placed in either your subclavian, jugular, or your femoral vein. So through this, these are very easily infected lines. So I wanted to show ways to prevent them by using CHG wipes, as well as educating our nurses about central lines. So through this, I implemented that we use a CHG wipe bath every 24 hours on patients with a central line, and I also did a questionnaire to see how much our nurses knew, kind of test their knowledge. So through this, I looked at a 6-month time frame for implementation. So I did November, December, January. They did not have the implementation of the CHG wipes, which is an antimicrobial wipe. And February, March, and April all had a CHG wipe implementation. So through this, the first 3 months of November, December, and January found one CLABSI, and the other 3 months there were no found CLABSIs. So it did show that the CHG wipes did help decrease the risk of infection. But I also, with my questionnaire, I asked some of the nurses, do you know what a CLABSI stands for? Do you know why the CHG wipes are used? Are you comfortable with central line care? So through this, some of the patients were, some of the nurses were not knowledgeable on what a CLABSI was or why the wipes were being used, if they were even following the protocol I was asking them to. So they were truthful with me and they told me no. So through this, it required me to show that we do need some ongoing education for these nurses, maybe some training, ways to keep our lines clean. So through all of this, it will help decrease the risk of CLABSI infections. So that's the main gist of it, but they're very lines that can, get very infected and cause more harm to the patient. They could stay in the hospital longer, more healthcare costs, even possible mortality rates increase. So it's very important that we keep these lines clean and free from infection.